Morning Cafe. Being a Thursday, we talk matters health. This morning we're focusing on arthritis. This is something that has been dismissed as a normal part of aging and more or less the same an older people disease, but is that the case? This morning we have Dr. Njeri, a general practitioner, to take us through arthritis. Is it curable? Is it preventable? Is it manageable? How do we deal with arthritis? And in Kenya, it is estimated that 1 in 4 adults above the age of 50 could show clinical signs of having arthritis. And of course, we'll be getting deeper into it as far as global data is concerned as we progress with this conversation. And we invite you to be part of it on our social media platforms, TV47 Kenya on Facebook and on YouTube, and on X at TV47 News KE. You can tag me as well at Ann_Dida, and there will be a number on your screen shortly. We invite you to call in as well. If you have any questions for Daktari, we'll be happy to hear from you. Karibu sana, Daktari.
Thank you.
All right. This might sound very basic, but for the benefit of our viewer and to set the pace for this conversation, what exactly is arthritis? I've started by mentioning that more often than not, this condition has been, referred to and believed to be an older people disease. And even as we talk about the estimated data in Kenya, it talks about adults above the age of 50. Mm-hmm. So what exactly is arthritis?
Okay, so arthritis basically refers to inflammation of the joints. Mm-hmm. And so in layman's terms, that means that the joint undergoes a process where it's eroded and there's swelling, pain, redness of the joint. Mm-hmm. So usually in the general population, mm-hmm. we tend to think of arthritis only as an elderly disease, mm-hmm. but there are various types of arthritis that could affect various ages. Mm-hmm.
Take us through that point now that you say there are various types mm-hmm. of arthritis, and even when we look at the data that is available, it speaks of one type of arthritis, the mm-hmm. other type of arthritis, and then they're brought in together. Then it comes up with a total data in regards to just all these types of arthritis that are available. So what are they?
So I'll start with the most common, which is what many people think about mm-hmm. when we talk about arthritis, and that is osteoarthritis. Okay. So osteoarthritis is the one that actually happens to affect the elderly. Mm-hmm. And I can get more into it, mm-hmm. but we have osteoarthritis. We have a type called gout. Gout is actually a form of arthritis, gouty arthritis. Mm-hmm. And the cause of gouty arthritis is not the same as what happens in osteoarthritis. Mm-hmm. Then we have types like rheumatoid arthritis, which is quite common. Some people may know of it. Mm-hmm. So still, when you refer to arthritis, that could be some of the types those are some of the most common types that we have in our setting. Mm-hmm. And lastly, we have what we call septic arthritis. So septic arthritis just means an infection of the joint that then leads to all those things I described earlier, the pain, the swelling of the joint. Mm-hmm. Then there are other smaller variations of arthritis that come with other systemic conditions mm-hmm. in the body. So, for example, you may find someone with psoriasis or lupus also has arthritic symptoms, aside from also having other bodily symptoms. Mm-hmm. Yeah.
When you talk about lupus, and now that you mentioned it mm-hmm. as one of the signs, now talk to us about diagnosis. Does now lupus, you're saying it sometimes presents itself as a sign of arthritis, mm-hmm. then how does that affect